Dr. Raquel Martin. Thank you so much for being here today.
Thank you for having me.
It's my pleasure. So let's just jump right into it. My first question is always, what was your journey into psychology? And by that, I mean, why did you decide to become a psychologist? And then once you decided you were going to be a psychologist, what was your journey to the population that you currently specialize in serving?
So I decided to be a psychologist because honestly, psychology was one of the, in addition to like Black history class, the most interesting classes I had at Fisk. Went to Fisk University for my bachelor's, HBCU in Nashville. And I was able to learn about psychology from the lens not only of people like Freud and Jung and things of that nature, but like Kenneth and Mamie Phipps Clark and Dr. Robert Williams and Joanza Kunjufu, and learning about the connection between psychology and public policy and being a change agent. Also wanting to work with community mental health and feeling like I always felt like I would have a job that also contributed to my community. Like I understand a lot of times we have realms where we have our job and then we have like community service when we dedicate to our community, stuff like that. And I always felt like my job would have to have both. Like it couldn't just be something that I did. It also had to contribute to my environment and my community. I was brought up in, I'm from Philly, so I was brought up in an environment where it's very much, what are you going to do to contribute to the Black community and the Black environment, stuff like that. So I knew I wanted my job to do that. And after learning about, and after going to Fisk, I learned that as a psychologist, I could do that too. My mentor in undergrad was Dr. Sheila Peters, who is the chair of Fisk University, the psychology department. She was also, and I'm not sure if she currently is still, the psychologist for the Tennessee Titans. She also is an ordained pastor. She also deals with like mentoring and stuff like that. So realizing that I could do a lot of things with the Black community by being a psychologist, and it's actually interesting. And also, there aren't many Black psychologists, and when it comes to being Black in America or Black in the world, not even America, because it's just a worldwide issue, it's stressful. There's so much research that talks about the fact that just being in an underserved, or I don't like saying minority, it's more so like populations that are historically excluded from the narrative and historically excluded from being in places that they belong. Being in that environment, being in the Black, brown, any community such as that, you automatically, like your baseline of stress is higher than the white population. So as the population who are less likely to go to see mental health professionals, but we are more likely to need it, I just felt like it made more sense to, you probably feel more comfortable if the person looks like you. So just being able to contribute to that and just really enjoying learning more about Black psychology, because I had a psych class in high school, but I didn't learn anything about Black people, or the fact that the Dow study by Kenneth and Mamie Phipps Clark was contributed to Brown versus Board of Education, or how Dr. Robert Williams was able to show justification for biases, cultural biases within assessments like the SAT and weights and stuff like that. Like I never learned that. All I learned about was like Freud and Jung and those boring old white guys. So it was interesting to learn more about that, and that kind of helped me gravitate towards the fact that you can be an agent of change and things of that nature, by also working in mental health, which was never brought up to me until I attended HBCU. And I don't think it would have been as appealing if I didn't have my first real psych class at an HBCU.
That's really cool. And that's really interesting, because you're right. When I took my first psychology class as well, it was not at an HBCU, and it was just, you only learn about a very narrow sort of perspective of psychology. Mm-hmm. And the way that it's painted is as though, these European males were the only people that had anything to do with anything important in the whole field of psychology. And we're taught that those are the people to study. Those are the people who were the geniuses. But there are a number of people that are completely left out of the narrative that you don't know about, unless you take a course that has a wider perspective or a wider approach to it. And so I think that's really valuable, though, because we don't learn that stuff.
You don't.
Unless you.
Right? Because
it really is.
Mental health is a public health issue. So like, not only learning about the mental health prospect of it, but you should also have some epidemiology in there as well to talk about how it contributes to public health in the crisis and how you change that. Because what I learned very early on is that there's only so many people I can help if I only help people on my caseload. So you have to also gravitate towards other aspects of change, curriculum development, research, public policy, speaking engagements at universities and nonprofits and stuff like that. Like you have to integrate it because, you know, a typical caseload, if you're intense, it's what, like 30 patients, and you can have an amazing amount of change with those 30 patients. But what you will learn when they're coming to see you is that it's a greater issue, that that they're complaining about the fact that their job is putting unrealistic expectations on them. This is what a lot of people are seeing. Then you need to advocate for EAP services, or you need to also do speaking engagements at places to talk about ways to do self-care in the environment, or, you know, like there's so many bigger things that, yes, you can work with your caseload, but every time what's going to happen, and what I think happens with most people, is when you're dealing with your caseload, you realize like, it's such a bigger issue. And like, how do I help out with this bigger issue? And with that is you got to integrate, you got to do policy, you got to do speaking engagements. You got to, you know, there's a lot of people out there speaking and mental health advocates. And I think that's amazing, but I don't feel as though professionals in the realm get as much of a public platform as they should. And with that, you kind of have to advocate for yourself in that realm.
Yeah, and I agree with that. And I think that you do, when you get in there and we're treating people in our communities, you do see that it's so much larger issue. And I think a lot of times it feels overwhelming because it's something that was around long before we ever got here. And it just seems like it's just this enormous uphill battle that's insurmountable just because it's ingrained in everything. It's everywhere. And it feels like there's so little progress that's been made. And I know a lot of times I feel like such a small part of a much larger issue. So I think it's a really important thing to think about going into different areas of it, not just doing a small bit of, which is a very important bit, right? Yeah, the part about, right. But it's very important, but it's still important to also do all of these other things, including the speaking, including the sort of raising awareness, including the policy, because otherwise, you know, it's going to take even longer to even make a dent in any of this.
Exactly. I completely agree. So that's what, you know, and being able to have my first psych class and realize that, like, I never knew, you know, we hear about Brown versus Board of Education. I didn't know that two psychologists were integral in showing and using their research to show the implications of segregation. Like, I never learned that. And it's just like, that's good to know.
Yeah.
You know, like
it is. It's very important, right? It's very important in what happened. And I think, well, it's interesting that you say that, because I think that always also speaks to, just for me, it spoke to my U.S. history class in like high school, the courses that we took to tell us about like U.S. history. And that too, as you said, there are all these other people that contributed to psychology. Well, in U.S. history, there are all these other people that contributed to these snapshots that they actually told us about and strung together as though this was the whole U.S. history. But there are so many people that contributed to these big things. Like, you learn about Brown versus the Board of Education, but you didn't learn about those smaller things in the U.S. history course. It wasn't until after that you're like, oh, that's why this happened. So yeah,
it's super annoying. So that's why I'm really like trying to get more into, you know, and additionally like curriculum development and stuff like that. But I genuinely feel like if my first university was a PWI, I probably would have stayed with nursing like I was going to do in the first place. So yeah.
Oh, that's interesting. So you initially thought nursing was going to be your path.
Yeah. One of my best friends, she's a nurse practitioner now, but she did like an accelerated program and has, you know, with nursing and things of that nature. And all the time I'm like, I don't know how you do what you do. And she's like, I don't know how you do what you do. So
right.
We're equal here. Like, I was like, no. Could have never done it. Could have never did it. Could have never did it. Could have never did it. It's so like, it's nurses. It's an amazing job, but I don't think I would have been able to manage it as well. There's so much burnout, and you know, it's interesting because there is so much burnout, but there's burnout from different aspects of it. Because, you know, licensed mental health clinicians, our burnout is.
Oh my goodness! Yeah, oh, it's real. Yeah. So tell me a little bit about where are you now in terms of your practice?
So I do private practice, and I probably never will. I mean, I would think about it, but private practice doesn't interest me. It's just solely because insurance companies are absurd and they really want to have their hands in your pockets if they even want to pay you. And then they want to tell you how many sessions you can give and what kind of therapy you can do. And none of them are licensed mental health professionals. So I'm always like, oh, I'm sorry, Aetna. Do you think it's better to do TF? You know,
I'm sorry, where did you get your PhD, Aetna? Let me know.
And you hear these awful stories about people not finding out they're not getting paid per session until session 6. And, you know, every time I talk to a patient, I help, like a lot of times since doing, being more present on social media, people reach out like, oh, can you help me find a clinician? But no one accepts insurance. And I'm like, and I always do my whole spiel. It's because they deserve to get paid. And they realize that insurance companies aren't trying to pay them. And also, dealing with insurance companies, they feel like they have the right to so much information about your patient. Like, oh, you need to give them this diagnosis. And any ethical license, you know, most clinicians are just like, that's not the diagnosis.
Right.
So I feel like that also needs to be shared more. Like, it's not because we don't want to accept insurance. It's because they don't want to accept us for ours.
Absolutely. They don't want to pay.
Yeah. But yeah, so I'm the clinical director of a residential treatment facility for children and adolescents who have been exposed to traumatic events. And most of the population has been exposed to some aspect of sexual trauma or exhibiting problem sexualized behaviors and things of that nature. And I teach at FISC part-time. And I also do psychoeducational assessments part-time too. Most psychologists, you know, we all have like a million jobs. So that's what I do right now. I just moved to Tennessee. We came down from Maryland because I did my internship and postdoc and things like that at Hopkins. And then now I'm in Tennessee. So I don't know if I would ever do a practice. I'm actually trying to get more into the realm of like curriculum development and speaking engagements and things of that nature, because I just want to reach a wider audience. But as clinical director of this facility, it's amazing to be able to impart so much change in not only having my own caseload, but also being able to help with therapists in their training and decide new protocols that have to do with like the way we do group therapy and things of that nature, or even like deciding what makes the most sense in terms of diagnostic criteria and, you know, the DSM-5, you know, the book that we all use to make diagnoses, are culturally biased. So deciding like, you know, we're going a lot more along the lines of symptom presentation. Like it's not only about, you know, the diagnosis that we're giving you. So I'm really enjoying that role in terms of being able to do the leadership part of it. It's different though, because, you know, you learn on the leadership side, it's very different than like most of the time I just want to do my job. It's like, listen, I just want to see my patients and do my notes. What is this meeting? Like, you know, like it's
right.
So it's definitely different. And I am dealing with that realm, but I also enjoy it because you can actually, I've learned that you can impart way more lasting changes from the top down. And that's one of the reasons why I think I also did a PhD, because there's a lot of realms to be able to be a licensed mental health professional. You could be a licensed professional counselor. You could be a licensed clinical social worker. But it's the way it is in this world. Most people want you to have a terminal degree if they're going to let you make the changes you want to make, which isn't the way it should be. And I feel like it's actually gravitating towards not being that way. But I feel like I learned very early on that like there's only so many people I want to be able to tell me what to do. And having a PhD, there's less and less people in the room who can tell me what to do. So that's, you know, I get that all the time. Like, oh, if you just want to do therapy. And it's like, yeah, it's a therapy thing, but it's also like there's you know, it's only so many people want to be able to say, oh, well, I disagree. And it's like, oh, do you disagree? Do you want me to like, show you my I can email you the publications, or I can show you them, or we can like, and that's just who I am as a person. Like everyone's not like that, but that's just who I've always been like that. And you know, like being one of the few Black people in the room and one of the Black professionals in the room, you learn early on like who gets a miss and who gets a mister and who gets a doctor and who gets like more airtime and who, you know, gets more when they talk. And
yes,
every time I'm in this room, it's always the doctors. You know, it's like, okay. So who I am as a person, it's just like, yeah. No.
Yep. I hear you.
You don't have to be a psychologist to work with patients. You don't have to do that to make change or anything like that. But the way these people are, the way some people are in the room, That's the only justification they need to like say like, oh, I'm going to listen to you. So it's absurd, but also like having to be able to be one of the Black doctors who's going to rock like the graphic tees and rock the ripped jeans and have the big pros and have the head wraps and, you know, use whatever vernacular I want to. And I can, you know, use a $20 word, or I can use a 5-1, or I can use like a Biggie lyric. And either way, you're going to know what I meant.
Right. Exactly. Yeah.
Because you can like it or not, but this is my department. So,
right. Absolutely.
You know, so that's one of the
I think that's great.
I decided to do a PhD because I just knew, you just know, like sometimes you just know, like, I mean, I don't like the way you're talking to these people.
Mm-hmm.
I feel like I'm gonna need another degree. I feel like I'm gonna need another because not a fan. So, but everyone doesn't. Yeah. That's why I always say, like, I'm a psychologist. People are like, oh, I want to be a psychologist too. And I'm like, do you though? Do you really? Or do you just feel like that's the only way to do what you want to do? Because like,
there's a difference.
There's so much licensed professional counselor, licensed clinical social workers out here doing the thing, starting their organizations. Don't even need to have a boss. They're the boss. They own those organizations. They're making those changes. Like you don't need it. But I also know I'm going to academia as well eventually. So, you know, don't feel like you have to. There are so many realms. There's so many people just doing it.
Right.
I do think you need,
especially since,
but yes.
Well, yeah, absolutely. But there's so much work that goes into it too. Yeah. Like, I feel like you have to be sure that this is the only way to do what you want to do, because there have been a lot of times that, like, before I got to the point where I was finally a licensed psychologist, that I was kind of like, is this, I mean, seriously, it just seems so long and there's so much work and there's so many ridiculous, like, obstacles and hoops you have to jump through, some of which are completely unnecessary.
Microaggressions, plenty of times. It was not worth it. And in some ways, honestly, it will never have been worth it. It will never be like 100%. I felt like this was worth it. It won't.
Really?
Because
that's interesting.
Things had to be put off.
Okay.
So some things it's like, yes, I really appreciate the change, but I also don't look back to the past. But if anyone could say, oh, would you do it the same exact way? I can't honestly say I would.
Okay.
I don't know, decided to go to a different route and start an organization instead. I may have like this. I love what I do, but I also don't reside in the past to be like, oh, if I could, you know, but if anyone asked me, I wouldn't say I would do it the exact same way. Because I can't 100% say
right.
Now that I know more, which is why I try to put an emphasis on any kind of time a student reaches out to me, can we meet? Yep. What do you want to know?
Right. Yeah.
Putting an emphasis on that. But no, it's good and it's interesting, but there are a bunch of ways to do it. And that's what I always say. And everyone's like, you know, it's not like it's not like I'm putting psychologists down. I'm not. But I'm also saying, sometimes you think the only way to do it is because the psychologist is doing it. And I'm saying if you look deeper, you will realize psychologists are not the only ones doing it.
Right.
At all.
That's an excellent point. Right. Yeah. There are other people that are doing these things, other ways that they find their way into it. And I think there's also just that, I don't know how to articulate this, but that kind of idea of, because we're sold this bill of goods that if we just get enough education or just work our way up, then we'll be able to, you know, break past the race barrier, the color barrier, like all that stuff. And we're taught, well, if you had just done better in school, or if you had just done this, or if you had just done that. But that's not true. And I wonder how much of that kind of beating into our heads about you got to get the highest level of education possible, how much of that is necessary and how much of that is just more part of the kind of like structure that's been put in place to keep people in their different levels.
Yeah. I have dealt with more racist mofos at the boardroom than the bus stop. Okay.
100%. 100%. Yep. Mm-hmm.
Absolutely not. But I think within the community also there's this whole thing of like, there was such a long time where we were not able to get any kind of education and we weren't able to be in these rooms, that generationally the goal was always to be in those rooms and get that education. But then things have transitioned, but our thought process kind of hasn't. So it's difficult to say to like older generations, like, oh, you know, I actually don't need all of this to do this. And it's like, well, yeah, we're not really vibing with that. We'll send you to school.
Right. Absolutely.
So
yeah.
also the fact that there's so much where we weren't able to kind of have that it's generational. They think that that's the only way we can do things because it was taken
right.
for so long. It's also how I feel about like religion and when it comes to church and just feeling like that's the only realm. For so long, we were insulated from every other community. All we had was ourselves. And when it came to that, it was the church. The church was
right.
sending people to school. The church is where you got educated. When you couldn't even be educated, the church is where you went when you had no one else to talk to. So I think it's understandable why within the Black community, and I feel like this is significantly changing now because there are licensed professionals in the church. There are counselors and pastors who are getting training. There are counselors and pastors who are like, here's a list of, mental health professionals that we have for you. But when people question this, I'm like, so for so long, we only had the church. So why would we feel comfortable outside of that realm? It makes sense. It's like, oh, we got to send, this so-and-so, this 20-year-old, one of the 20-year-old parishioners to school. Okay. We pass around the plate. Oh, so-and-so is struggling with shoes. We pass around the plate. Oh, so-and-so, concerned about them getting lynched. We protect them as a whole. We only had the church.
Right.
So it's understandable why people don't feel comfortable in other realms, because not only is it the harm that the world has done, but there are mental health professionals, there are doctors, lawyers, all these who have done harm to our community as well. Like we are not Black, white, and other. Like we are not omitted from it. So I think it's, it's super understandable that, sometimes they're like, oh, Black people don't want to seek out help. Black people do want to seek out help. We just want to seek out help and not be, attacked.
Right. Abused. Taken advantage of. Yeah.
Unethical
judged.
So every time someone says that, I'm like, it's interesting you should say that. One, you're wrong. But two, let's keep that apart. Let's just go off of what realm you're talking about.
Right.
Because it's not possible to talk about Black mental health without talking about the systemic racism, the destruction of the Black body, the unethical medical practices that this world was built on. You can't talk about Black mental health without that. As soon as you say that, I'm like, I'm sorry. I think you missed like 27,000 points. Do you want to go back?
Right.
One?
And that's what always happens is they jump to some end statement. It's like, but you're missing a whole lot. Like, first, that's not right, but you're missing a whole lot within there that makes you understand how we got to where we are today.
Yeah. Just like,
and there's just that complete misunderstanding.
Not right.
Yes.
Just want to, before we even, because you may stop listening.
The most important part.
I want you to hear the first part because you may stop.
Yes.
Because this is going to be a long one. You're wrong. So as long as do you have that part? Can we, because it's just like, and every single time I'm like, well, I can see, I thought I was going to be done with this meeting in 10 minutes and y'all going to have to wait.
Yeah.
Hear without hearing what I got to say.
Yeah. Yeah.
And this is my department. It's just it's absurd. It's crazy. It's just crazy. But yes.
Yeah. But it's also exhausting. Like sometimes I just get tired of constantly like hearing complete misinformation and then having to correct it. And sometimes I'm just like, can I take a break? Because it's just, if you choose to do every single time, like, I don't know if you'll make it. If like every single thing you have to like correct some sort of wrong, that's just like, like,
I don't think you will make it. And to be honestly, on the Self-Care Chronicle, that's part of my self-care. Deciding who I'm going to educate.
Yes.
Because I used to feel like I used to, it's so amazing getting older because like I can just laugh at how absurd I was at times because I am from up north. My attitude was rough. Okay. It wasn't solely about educating people. It was like, I'm about to tell you about yourself. But I always felt like I had to tell every single person about themselves. And it's just like, because it's draining. It's draining.
It is.
So, but it's also draining to me when I felt like I could have educated someone and I didn't. And I would continuously, I would ruminate on it and be like, now this person is around thinking this. So you have to decide what is worth it. It's not always worth it to educate someone, but it's also not always worth it. Like if it's someone I know who's not going to be receptive, it's like, okay.
It's a waste.
Just look the other way. It's really just like, I disagree.
Yeah.
That's it. But if it's someone who you can't always tell if they're going to be receptive or not, you have to choose because it's not your job to educate everyone. It is not your job to tell everybody about themselves, even though that Sometimes it's very fun. But
Right.
in order to protect my self-care, I had to learn that, like, I need to not educate every single person. I need to not do that, because it becomes exhausting, it becomes strenuous and things of that nature. So I had to learn that was also contributing to me being stressed out sometimes, feeling like, and it's hard because if you're the only one in the room, which most of the time I am, it feels like it's your job to do it. And it's not always your job to do it. That's also an example of the systemic issue, because why am I the only one in the room? And why does it take a Black person to educate you about this? We are not the only people educating. We have allies as well. I can't be the only person who found something wrong with that. Don't think like me being the only Black person in the room means that you can't speak on it as well, because that's where we get this thing, like people doing hashtags and saying that they're allies. And then when it comes down to it, they don't say anything.
Nothing.
Don't feel like the Black person is the only person who has the right to speak on this. We can speak on experience, but if you are an ally, if you identify as an ally, then you need to realize that your words matter as well. Because one of the reasons why we're called minorities is because we're the lesser group. So in order to incite change, white people need to help too.
100%. Absolutely.
Not just with a hashtag, show me your money. Not just with, hiring someone for that position, but putting other people in positions. Not just for just saying, posting a video, but reposting other Black creators, allowing people to be in the rooms that you're in, talking out about the fact that Black creators are getting silenced on all platforms, like things of that nature. Because a lot of times, in mental health professionals, I think like we're just starting to do more social media stuff, because honestly, most of us were not feeling it. So I feel like we're just starting to do like social media and podcasts, and you see all these people who use social media to grant their platform, and they get so many opportunities as a result of it. So if you're trying to help us, you need to start advocating for Black creators as well.
Right.
It's like, and don't ask them questions only about themselves in comparison to the majority. We have our own narratives as well. It doesn't have to be in comparison to you. You can just ask me about my experience, not just my experience when compared to someone else. Like that,
and we don't.
It gets
and that tendency to ask us to speak for the entire group.
Yeah.
Like we are the representative, just like you said, in that room when you're the only person, and then you feel like you have to speak up, because the thing is, if you don't say anything, everybody in that room is then going to say, yeah, but I knew a Black person. We said the same thing. She had no issues with it. She didn't say anything about it. She didn't say it was wrong. So I think clearly you're wrong. Do you know what I mean?
And
like using,
like she didn't say anything about it, and she didn't have an issue about it. Those aren't the same thing.
So those you just assume, absolutely, they are. They're very different.
Because she knew you weren't worth her time. Because she knew you weren't going to be receptive about it. That doesn't mean, and I can't even speak to that. But most of the time when people do that to me, I have a very smart mouth anyway, which is very obvious. But I'm speaking for every single Black person in the world.
Yes.
I think at our last
meeting,
we decided that we preferred a Bantu knot to a twist out. So then we're going to have to expel you from the community.
Right. Yeah. There's this belief that we just all know one another. We all must somehow congregate. We must. Let me tell you something. I was at where was I? This is a while ago. I was at some zoo. I think it was the San Diego Zoo or the San Francisco Zoo, and I don't remember which one it was, but I was actually with my mom. We went to get lunch. She had already gone outside. We were in the cafeteria. So I bring up my tray, set it down on the register. Some random Black woman comes up behind me, right? And I'm ringing up, and he looks at her and he goes, "Oh, do you two want to be rung up together?" And I was like, we just looked at each other. And we were like, we don't know one another, sir. We have never seen each other before. She just randomly came up here, and you are assuming that we must be together. There are two of us in a row. That doesn't happen.
And in San Francisco, nonetheless. So,
It's like, I was like, this is just ridiculous. Like, absolutely ridiculous. But just stuff like that, where it's just, we speak for everybody. Yeah. It's like,
and it could be
we must know each other.
I had a similar experience with someone asking how long I knew someone. It was like this is old school, so it was either like a bank line or something like that.
Okay.
And I was like, "Oh, we just met." And she was like, "Oh, you seem so like congenial," and I was like, "Oh, that's because we're Black." And it's just like, I was explaining to my white friend one time, there was this episode on Blackish about the black man nod. And I was talking to my black friend.
Yes.
And then my white friend had happened to listen, and I was like, oh, well, women have the same thing. Like, I always smile and say hi to every black person I see, and especially women that I see. And I was like, with dudes, I typically do like the black man nod anyway, because I don't know how receptive they're going to be to some random woman, saying hi to them, So, and she was like, do you really do that? And I said, yes. And she said, why? I said, well, why wouldn't I? There aren't that many black people around here. So why wouldn't I? And she was like, that's interesting. Do you think all black people do that? I said, I do, because I always get it back too. Now, my husband, the reason why we're talking about the black men now, because my husband had this whole thing about generationally black, the younger black generation does not do the black man nod. And he was like appalled about the fact. And I was like, you're not even cool. It's like, he's like, you see another black man, you give him a nod. He said, I've seen these little black kids. They don't give me the nod. I'm like, all right. I don't know about that. But just saying that, like, yes, it's just like, I'll see a black woman in the room. It could be something random. I'll be like, hey, that's it. And it honestly could just be a conversation, because it's like, I feel like it's always like, I see you. I see you.
Yeah, absolutely.
I see you, and I know that you're seen in this room, and we in this room together.
Right.
Like, I see you.
Yeah.
And I feel like it's always necessary to do that with black people, because so many times we are not seen by other people. And with me, when I'm talking to people, black women and black men, it really is just like, I see you out here working. I see you out here struggling. I see you, and we are the only one in here. And it's just like, it's just good to be seen when in so much of the world.
Yeah.
I'm like, that's why I feel like it's so important. But I think we know each other. Now, granted, I am a very gregarious, exuberant person, so it would be difficult to know if I've known someone for 10 minutes or a year, just because of who it is as a person.
Right. Yeah.
Just because of who it is. Every single time you can see my baby teeth. This is just me. It's not always that. Sometimes it's just like, oh, is that your cousin? What?
Oh.
Cousin.
Must be. I mean.
I think so.
What?
Or it'll be like, well, you never know if you're related. Or like my friend, her last name is Smith. And she, like, a lot of my friends have really smart mouths. That's why we're friends. But her last name is Smith. She was like, someone else was like, oh, my last name is Smith too. And she was like, yeah, it's a pretty common name, that slave masters gave to my ancestors, and I now have. And I was just like, and she said it's a white woman. I was just like, man.
Was she super uncomfortable?
I can't tell you how much I love you at this moment.
Yes.
No way for you to understand. Because it's like, yeah, I'm sure it's a very common name. There are a lot of slave masters who gave us that name. My name isn't.
Yeah.
Like, it's just
so. That's funny.
No, like, shut up.
Right. Yeah. I mean, right.
Do you think that's really like, if we went down the line, that might not? Come on, man. Let's just be smart.
Right. Yeah.
But yes, I do enjoy being a jerk at times. It's fun. It is fun sometimes, because it's just like,
nice. Yes.
That's my self-care as well.
That's your self-care. Well, that was okay. Well, first, what's the most stressful thing about your job? And then we'll talk about how you counter that stress with self-care. What's the most stressful thing about your job?
So all of my work is in trauma. It's dealing with children who have been neglected, assaulted, victims of sexual trafficking, exhibit trauma, sexualized behavior, have a background or a history, some of the worst things I've ever seen that I will never experience, and they could be 10. So it's very difficult to work within that realm with children and then come home and not worry about my own child. When I was sending my child to daycare, it was very stressful. Not only because like he was my first child and sending him to daycare, but also just because, I don't subscribe to like bad things happen. Anything happens for a reason, or, everyone gets what they deserve, because I've seen some people get amazing things that they didn't deserve and horrible things that they didn't deserve. Things just happen.
Oh, yeah. Yeah.
So when people say that kind of stuff, I always say, I don't subscribe to that.
No, it's a just world hypothesis, and it makes no sense.
And, the one thing about working in trauma and being in trauma, and the one thing that changes like a person who have dealt with a traumatic event is because it changes the way you view the world. And that's what makes it so difficult. If you held these priorities of like good things happen to good people, then why did this happen to me? And that's why that narrative is so damaging, because that's not the case. There's not one thing you did to deserve this. Right. Period. So I would say that's the most stressful thing. And sometimes understanding that the system is broken and there's not enough money for mental health and there's not enough money for resources. I would just give every single person who comes into my office in there, it's hard to focus on mental health when they're worried about rent and mortgage and stuff like that. So, and that's another thing that pushes me more to come up with bigger changes and things of that nature, because it's stressful to realize that after you leave my office, after we do this 1 hour session, you're going back into this world that doesn't respect you, that doesn't, and it just, so that's fatiguing. But a lot of the time, just being a parent and, dealing with child trauma and coming home to my baby and having to manage that. I manage it a lot by not disconnecting, but before I come in home from like a really tough session, a lot of times I don't come straight home. Because that trauma and that stress stuff will come in the house with me. So a lot of times when we're working with, if we're doing trauma-focused cognitive behavioral therapy, there's this process where you have to do your narrative. And you have to do your trauma narrative, and the child has to write their narrative, and then they have to talk about their thoughts, their feelings, their behaviors, the senses, the smells, the everything. And you have to do it multiple times until they no longer have like a higher escalation of stress as a result. Okay. So sometimes you are hearing someone talk about the many times that they were abused, the many times they were raped, the many times that they were punched. Like you're in the room with them, so you have to go with them through that. And it's hard not to take that home. Those are some of the toughest days. Yeah. So when I have like high days where I know like if I am going through a narrative with someone, I see it as like trying to find the pockets of joy. I'm not coming straight home. Even if it's just me listening to like a funny podcast or like listening to The Read or watching I don't know, memes or something. Like I have to have some kind of separation between leaving the office and walking in the door, because I do want to be fully present for my family, and I can't continuously be ruminating on, I don't know, this child got assaulted by a daycare worker and I just dropped my child off at daycare. Like you can't live that way. But it's also important to realize whether or not you can work in that realm, because trauma-informed care is not for everyone. It's just not. I think it's nothing better than knowing what you can do than also knowing what you can't do, because you can also do just as much harm being in a realm that you cannot appropriately provide the right amount of care. So I do that. Yeah. I try to be very present. Like I make sure that I'm not like on my phone weekends and evenings. Most of the time I'm not able to talk to friends because that's when I'm not working. Well, I'm working, but that's when I'm not like at my 9 to 5. And my child doesn't have screen time, and I want him to know that I'm present because I'm present and I'm looking at you. So most of the time, if it's like after 6 or after 5 or it's a weekend, my friends know they most likely can't reach me. They can reach me after 7 when the child is asleep. And even then it's like the child is asleep, then I can actually spend time with my husband. So like kind of separating that realm. I do a lot of phone calls on my way to work and on my way back. Yep. Because it is good to check in with friends. Sometimes it's stressful feeling like you're losing time with your friends. So what I find is helpful is I'll do voice memos, because sometimes you don't have enough time to talk. So I'll do voice memos and I'll send voice memos. Or where I'm prepping dinner, I'll put them up and I'll record a video and I'll send it to my friends. Like, yeah, girl, what you doing? So let me tell you what this food is today. Because you're still able to be present. You're still able to check in, because I think a lot of times it's stressful to not feel like you're up to date with your friends. You're like, right. My friend in a whole, like, I was a whole person before I had a child. I need other things. So I do that. And even I always tell like everyone, like find a moment to have a pocket of joy. Now, care does not mean, it seems like it's so indulgent, but it's not indulgent to take care of your body. You take this body everywhere you go. Kind of treat it right. But when I say pockets of joy, it could be like 5 minutes. It could just be like, okay, well, I'm going to take 10 minutes to drink my tea while it's hot. Imagine. Right. Yeah. Jesus. Like I didn't even know tea became hot. You're surprised. It's surprising how many, my husband looked at me and I eat food and he was like, that food is cold. All my food is cold, you mortal. It's cold.
Right.
What? He's like, how do you eat food cold? I don't know. So many opportunities to either eat it cold or not eat. You probably,
right.
you know,
Lesser of two evils.
Yeah. I eat everything cold. He's always disgusted, and I'm like, man, it's either this or starve.
Right.
So I always also try to find the pockets of joy, like just 10 minutes of tea. That's warm.
Yeah.
Or I don't know, you got to limit this, but 5 minutes of scrolling. Or, you know, spraying an aromatherapy room spray and just reveling in it, just being like, you know, like it doesn't have to be much, but I always feel like I tell my patients, like, come up with a list of stuff and figure out which one you're going to do. You come up with a list of things you really like, put them on a popsicle stick, put them in a jar, pull it out. No matter what, you're getting to do something that you like, and you do that once a day. Because it's going to be something you enjoy. You know, but just trying to, don't feel like you can always pull things out the air. Write down the stuff you like. You know, come up with a list, and then just do it. And if it's always about time constraints, make sure there are things that you can do in 5 minutes.
Right. Yeah.
Like that's hugely important. Yeah. Always a solution. Like not everyone, of course, they're like, well, I don't have time to, get my nails done. I mean, who said that your nails done have to be the only way that you get some kind of joy?
Right.
Why don't you look for some press-ons and then your nails are done and you like them? Because these press-ons these days are amazing.
They're good. They're really good. Yeah.
I'm just saying. So yeah, I just separate myself from home, from work. I provide that like buffer. And then I also just find ways to, I really do just categorize the things I like doing. And then I just pick from a list and go from there. But sometimes it's 5 minutes, sometimes it's 10 minutes, but I always do something I enjoy every day.
Okay. Nice.
That could be chewing a piece of gum, but I like it. Like, it doesn't always have to be so intense, but if you go so many days without doing something you enjoy, you start thinking like, what's the point? Oof. Natural response to not having any joyful experiences through the day. So no matter what, you do something that you enjoy that day, period. And if you tell me that there's no way you can do that, then you're telling me that we need to have more than one session a week because we have more problems.
That's true. You don't want to be in that place where
it's like, so what you're telling me is you need to do Mondays and Wednesdays.
Right.
Mondays will be normal session, and then Wednesdays we will do something you enjoy during the session for half of the time, and we will process that for the other half. So that's what you're telling me. That's what I'm hearing.
Right. And so I know you have a whole other person that you are now in charge of. Mm-hmm. But what are some of the challenges of being able to practice, good self-care on a consistent basis for you?
I think in the beginning, I used to feel like I used to have the typical Black Superwoman syndrome and be like, there are plenty of people who don't get this extra time. But then I just realized that I'm a better person when I do take care of myself. Like, for example, I was talking to my husband about the fact that I will never be a parent who could be around their child 24/7. It's just not going to be a thing. And letting him know, and I said it as clear as day, I'm always very direct, like, I can't be a good parent if I'm around my child 24/7. Just can't.
I think that's valid. Right.
So it's like, I can't be a good mother if I don't take breaks. And, I understand that I'm very blessed to have someone who also helps me tap out and to be married and stuff. That's why when he was freaking out, and I'm like, I'm not worried. He got a whole other parent, honey. That ain't got nothing to do with it. I don't see it. That's not my problem. Yeah. But, just realizing what my threshold is. And I think that helps by self-monitoring. Like, I'm very aware of when I've gotten to a point when I need a break. Like, a lot of times I am a butt and that's how I can tell when I'm stressed out. Like, I am just a jerk. Like, when the responses are unnecessary, when I'm over here constantly sighing. And some people, they're not comfortable stating that, but oh yeah, if I have had multiple responses that are like, that is a typical a-hole response, I need a nap. I just know, because my threshold, my frustration threshold goes down when I'm stressed. So it's
right.
Even just being monitored, like I say something and I'm like, that was unnecessary. Okay.
Right.
So, yeah, just being like, I think I need to kind of dip out of this. But you also have to be aware, like you have to be present. You have to know that, I eat more junk food when I'm not feeling too good. That's a sign of not doing well. I just snapped for no reason. You have to realize, you have to be true to yourself, like, that was unnecessary. You think that was necessary? There's no way you do. That was, like you have to be able to self-monitor. And I think that goes in hand with self-care. You have to know what's going on. Like your body, there's always an arousal in your body that comes with an emotion. But sometimes we don't pick it up, whether it's increased heart rate or sweating or feeling flushed or racing thoughts. If you have enough self-monitoring skills to know that this is happening, then you know that like something else is going down. If I know that I'm sleeping and I'm not feeling rested, if I know that I typically have like one chocolate bar a week and I've had 4 and it's Tuesday, you have to be aware of how you are at baseline so you can know when you have gotten away from that. The problem is a lot of people don't know how they are from baseline because it's been so long. Like so many times you think, oh my God, I keep getting this whole thing about like people having ADHD and I'm like, oh my God. Like you may have it, but I'm telling you, you don't. You're asking me if you're ADHD, you're telling me you can't focus, but you're also telling me you're getting 4 hours of sleep, you're eating crap, you haven't gone outside in front of a screen. Fix these, and then I will give you an assessment. Right. Like it's just, and plus, oh my God, I forget the name of the doctor, and I'll send it to you. She gave me the best analogy when it came to attention difficulties. She said she tells her patients that attention difficulties are like a fever. And when you bring a child into the doctor, you know they have a fever, but you don't know if it's an ear infection, a stomach ache, the flu. You just know it's a fever. So when you come in with attention difficulties, it could be anxiety, depression, regular amount of stress, sleep difficulties, too much caffeine, poor diet, not enough sun. Because a lot of people don't realize that if you're having lack of sleep destroys the way your brain can function and decreases the amount that your brain can be productive, right? Yeah. Vitamin D, like getting actual sun, actually convert like within your body, and there's a whole process, but nobody cares about the process. It converts to natural melatonin. You're over here taking melatonin. You just need to get some freaking sun. And it's one of the reasons why seasonal affective disorder is so prevalent, why people feel difficulties with sleep and managing their body, because sun is not just helpful because of the sun. Some people are like, oh my goodness, I'm out in the sun, I must be tired today. Yeah, you got your threshold, and it helps you to sleep better. So the sleep difficulties also connect to the attention. So there's so many things. You have a fever. Yeah. But we don't know what the fever is. And I'm going to look it up, because when she told me that, I was like, man, you are so
That's great. Yeah, that's such a great analogy. Yeah,
it's a fever, so it could be that. It could be anxiety. It could be depression. It could be
anything. Right.
Stop eating crap and go outside. Right. Eat a banana and sit outside, for God's sake, and take some water.
Right.
And walk around.
Yeah. That's really great, because the fever it's the idea that your body's telling you something's wrong, and you've got to figure out what is causing this.
And I think that's the fact that, like, I know people say that ADHD is overdiagnosed. For some people, it is overdiagnosed because you have to have a clinician that has an appropriate cultural competence. A cultural competence doesn't only have to do with race and ethnicity and culture. It also has to do with understanding how to put things together to conceptualize a case appropriately, right? Some people may see that. But if you're not getting enough background and you're not looking at the fact that you have 4 hours of sleep and you have caffeine and your last caffeine is at 8 p.m. and then you try to go to sleep at 9 and your last screen time is 8:30 and then you try to go to sleep at 9 and then you haven't been outside all day and then you try to go to sleep at 9 and you don't know why you can't go to sleep. I mean, pick one.
Right. Any one of those things could. Yep.
So that's why self-monitoring, it goes hand in hand with the self-care portion. So I just make sure I monitor. I make sure I check in with my statements that, because I have a smart mouth. So statements that I knew, like I said this because I wanted to insult you. Like, me and my friends, me and my husband, we have a very tit for tat. Like, this is how, people always talk about love languages. Insults are my love language. That's just, my family.
Was that one of them?
That's one
in the book. Yes, was one of them.
My family. We go hard, okay? And
yeah.
And it's like, yes, we do healthy aspects of love languages too. We say we love you, we hug you, we kiss you, all that.
Yes.
We also tell you your hair looks like buckwheat and you need to go somewhere. What is, like you can do both.
Right.
So it's different between like joking and stuff like that versus like, ooh, that was unnecessary. And most of the time I'll say, that was unnecessary. That was excessive.
Okay.
I never have a problem apologizing and going from there because honestly, just like I have no problem learning things, my identity is not immersed in always being right and not accepting when I'm wrong. So that's why I never have a problem apologizing and also, dealing with that and make sure I monitor. And because one part of apologizing is making the statement, but another part is actually having the action to reduce the harm. And if I reduce the harm of being a jerk by taking care of myself, I need to take care of myself.
Right.
Let this man leave me.
Yes.
But I'm always aware. I'm just like, ooh, that was excessive. I'm sorry. I am so sorry.
All right.
Really? And I'm like, you're right. Or when like,
so how many of those?
I don't feel like doing stuff. Like my husband, he'll ask me to do the littlest thing, and I'll be like, oh my god, what? I asked you to pass me the cup, and the cup is in your hand. I'm like, oh my god. I mean, anything else?
Yeah.
So just monitor.
Right. Okay. All right.
Knowing when it's a thing, because I can't be the only person who's more of a jerk when they're exhausted.
No, of course not.
But they just may not know it. And I'm like, yeah,
right.
I've been a bit of a butthole today, so I think I need to separate myself and go to sleep.
Right. Early. Yeah. Yeah. That makes sense. Yeah. Those are really good things. Yeah, those are really good things. And especially the idea of just insight into yourself and self-awareness, understanding, your baseline versus what you're behaving like right now and what could be causing that, and then fixing it.
Yeah.
So 2020 and now 2021, it just seems like it's one thing after another, but there's been so much. And obviously we know that, in our communities, in our Black communities, tragedy and trauma are not new things.
No.
But it seems like, from 2020 to, where we are now in 2021, we had the pandemic, we had the just multiple murders of unarmed Black citizens for no reason at all, or with very little provocation. We had the social justice protests. We had the terror attack on the Capitol. We've had the increasingly violent random attacks on Asians. I mean, we're seeing all of these things around us. And it seems like just one thing after another, and we can't seem to escape it. Can you talk a little bit about whether or not, pardon me, this past almost year and a half has, this past year and a half, whether or not it's impacted your mental health as a Black mental health professional, and if so, how?
Yes, I would say so. I mean, a lot of people not being able to have access to care, me having a lot of anxious thoughts about COVID as overall. For example, we moved to Tennessee and we got a new house and nobody has been over. We've had a lot of big life-changing events, and I won't let anyone near anything. Like I'm fully vaccinated, by the way. So there's that. My son can't wear a mask, so not really letting people be near him. He's about to be 2, and I'm hoping, of course, my mom can come and see him, but even that was like a big thing. And my mom is vaccinated. It's just
okay.
So a lot of different things, and having concerns about just honestly being concerned about COVID and like what life is going to look like. Even something as simple as like we were considering and still are considering having another child, but I'm like, my husband, he's like, I was just like, I mean, if this is the way the world is going to be, and he's just like, we don't know that though. And I was like, but do we not? Do we bring another child into this world? And he's just like, luckily my husband is a good balance, but I think it's also, one thing is important to understand that, it's like mental health professionals are people too. So we struggle with stuff too. So I would say the anxiety and also like depressive symptoms associated with that. Like I felt like I left my home like a thief in the night. We planned on having a big to do, like a big party. Everyone. I didn't get to do that. We have our first house and it's amazing. No one has been over. We're in the same state. My husband is from Tennessee. He is a Nashville local, which there aren't many these days because there's a lot of transplants coming here. From here, his friends that he's had since grade school are here. Best friends, best men in my wedding. We haven't seen them, and we've been here since September of last year.
Wow.
His parents are here. We don't get to see them very often. You know, like it's just. So I can understand why people are having depressive symptoms as a result of that. And even with my client caseload, they're concerned of some people just really gravitate with enjoying the company of others. We're not meant to be isolated creatures. There's concern with that, as well as the concern with the like, oh, you only do engage with people when it's a necessity. So how do you get to tell me that not seeing my mom is not a necessity? You know, like talking to them about that fine line, or even some people who are uncomfortable with talking to friends and families who are less receptive to like the CDC guidelines and the peer pressure of being like, I don't want to go to that event. I don't want to go. I don't feel saying I don't want to go because peer pressure doesn't stop just when you're a teen, you know? So like feeling more comfortable. Some patients are feeling less comfortable with advocating for themselves and empowering themselves to say, no, I don't feel comfortable going. And I know everyone is going but me, but I will not be there. Like it's not only about not going to events, and it's hard because it's not because they don't want to go, it's because they don't feel safe. So sometimes some people think like, oh, I have no choice. There's always a choice. Sometimes the choice just sucks. And it's very difficult for some people to make a decision when it's not a typical win-lose situation. Sometimes it's like lose an arm, lose a leg.
Right.
Or losing.
Yeah.
You know,
either way, yeah.
A lot of people I think are struggling even more internally because these decisions aren't as clear as I win or I lose. It's like, I still want to go, but I don't feel safe going, so I can't go. And I'm upset with the decision that I made, even though it's the right decision, but is it the right decision? Like that just internal struggle, I think, has been coming out of patients a lot. And then access to care. You know, luckily I was able to get vaccinated because I have not stopped working since we have been in the pandemic, seeing people in person and not in person. So of course I was able to get vaccinated, which is amazing. But some people just being like, you know, being vaccinated isn't only just for people on the front lines, it's also for people who just want to spend more time with others. So I think that's also been a struggle, and understanding that this is hitting, you know, underserved communities more because we don't get this. A lot of people are not working in these jobs and these office jobs within those communities where they get to work from home. A lot of them are in, you know, doing, you know, Amazon employs so many people, or supplementing their income or supplementing their income with food delivery services, and they don't get to get unemployment, or they don't get to get the vaccine. And as a result, they're concerned about their health, but they can't survive without it. You know, so just seeing that struggle in myself as well as in my patients who are all just trying to manage it.
Okay. And can you talk a little bit about, you know, I don't know about you, but in my training, there was always this idea that in order to kind of take care of ourselves, or in order to be like a good, you know, clinician, you had to find a way to completely disconnect from your clients, their stories, their journeys when you weren't at work. So this idea that, pardon me, once you leave the office, you kind of put all that stuff from your clients, all their junk in a box, sort of throw it, keep it in the office, and then you are doing something completely different. But, you know, as a Black mental health professional, we're listening to people come to us with concerns about all of the topical issues, the pandemic that is disproportionately impacting our communities, the murder of unarmed Black citizens, which are people in our communities, you know, the protests, which also, you know, were differentially impacted by and because our communities were differentially impacted. So we don't really have that opportunity to completely disconnect, because all of their concerns are our concerns, right? Mm-hmm. Because we're concerned about the same things, because these things affect us. Do you need to get baby?
No, it's not the baby.
You sure? Okay. So do you need to go for a second?
No, I don't need to go. I just wanted to make sure the sound wasn't picking up everything that's in my background. But continue. I'm sorry.
Oh, okay. No worries. So can you talk a little bit about just the idea that as a Black mental health professional, you don't have the luxury of completely disconnecting, because those things that you're hearing from your clients that are, from Black communities, we can't really detach from it because it is us, it happens to us, and we have the same legitimate fears as well, oftentimes. Mm-hmm. So can you talk about how you were able to, in light of that, still take care of your own mental health and still return every day to be able to do the work, as opposed to just becoming so burdened by it, by hearing this day in and day out and not being able to disconnect from it and still being concerned by it? Like, how do you make it so that you're not just completely overwhelmed and overburdened by all of that stuff and no ability to kind of like completely disconnect or completely detach? Does that make sense?
Yeah, that makes sense. It's not possible for me to completely disconnect. And, I'm not sitting here thinking about my patients' lives every single second of the day, but I would be lying if I didn't think sometimes, if I like thinking, having 10 minutes to wonder like how they're doing using their skills this week, or someone who has a significant, traumatic event with being exposed to racial stressors and wondering how they're doing this week with the case in Minneapolis, like that. I don't just stop caring because, it's clock out, and I also can't disconnect because these are things that I also worry about. A lot of times my patient will come in when I'm working with families or when I'm working with adults or things like that, and they'll bring in concerns that I have as well. Like, yes,
right.
I am also concerned about raising a Black man in America. Totally understand. Yes, I am also concerned about the impact of Tennessee just passed between the House and state and whatever about being able to carry guns without being licensed. Yes, I am also concerned about that in a red state where we say that it's a law, it's going to be okay now, but we really know it's only okay for white people. It's not going to be okay with white people. Yes.
Right. It's only right for some people. Mm-hmm.
So I can understand the concern and that separation. But I honestly, I just tap out when I need to. I self-monitor to know when I'm having like a visceral response to something. I acknowledge when 5 minutes when it comes to pockets of joy isn't working, so I need a day or two. I acknowledge the fact that just because I took a day off doesn't mean that anyone else needs to know I took a day off. I can leave this house like I'm going to work, come home 5 minutes later when my husband leaves and be like, and I think this is something that people need to know. No one else needs to know you took off but your job. So, because sometimes when you pick off, it's like, oh, can you pick up so-and-so? Can you do this? Oh, no, girl, I got work. You have to tell people when you take off. And also with jobs, like, you don't need to tell them why you're taking off. I had the therapist at one of my staff she's like, oh, I need to take off because I'm going to stop you right there. That's none of my business. I have nothing to do with that. And it's because a lot of times we're in these organizations where you feel as though you need to be beholden to them and you need to justify taking off. You earn this day. This is your day. So it also goes in with self-monitoring, like being mindful of, and also participating in my own therapy, being mindful of, things that are going to be difficult for me and things that are going to be triggering for me and things of that nature. And making sure that I'm also processing them in my own time and taking time when necessary, because it's not possible for me to 100% disconnect from someone who is scared for their Black son when I also have those same fears. It's not possible to disconnect from the fact of being concerned about the racial stresses in this world, because I also have those same fears. But because of that, I feel like there are only certain things that you get from living in this Black skin and being exposed to the things that you're exposed to in this Black skin. And it helps me to identify and provide that strength. I'm not going to bring myself into the session because this is your time, but I am going to try to empower you in different ways that may be helpful for me to empower myself and see if they also land with you. So being mindful of, it's not possible to disconnect. That would be, people who are able to do that, I would love to see them do it. Because I've never, in most of my circle are Black psychologists as well, because we came up together in training. Most of my psychologists are Black people. A lot of my circle are like the training, all of the psychologists I know, honestly, most of them are Black because,
Okay.
I met you at the Division 45 conference, or I met you at the, like, or I met you
Yeah.
at the psychologist group or stuff like that. So it's able to do that, but also to deal with the compassion fatigue is have a clinician. Talk to other people who understand what you're going through. Maybe you need to take a minute to check in with your staff and see if, and colleagues, and be like, is this something that you're struggling with too? Because they get it as well.
Okay.
Like, and HIPAA is real. So you can't talk to everybody, but anyway,
right.
So my job and working with children who have traumatic events and trauma, I talk to my mom about it because she also works in foster and kinship care. She is assistant director of a foster and kinship care program. But I don't ever talk to my husband about the intricacies of my job because honestly, it's intense. When we have interpreters and translators, we have to give them a disclaimer about the stuff that they're going to hear because it's such stuff to hear. Personally, I don't feel the need to put. And I kind of refer to them as civilians, to be honest with you. I don't find the need to put the stuff that's in my head in the head of other civilians. I just don't.
Right. Absolutely.
I've always worked in community mental health. I've always worked on becoming certified in evidence-based practices with trauma and being educated in trauma. And in doing that, I have made that decision for that to be my specialty. But when it comes to other people, it is like I see them as civilians, and it's like I'm not gonna talk about my day being tough because I had a tough patient. Like, I'm just trying to get these resources for this kid, and it's not working how I want to. But you don't need to know to get these resources for this kid because their background is intense, their other stuff is intense, and their presenting symptoms are. You don't need to know that to provide me with help because that's not your responsibility. I don't feel like I get everything out of one realm. In my relationships, like I don't get everything from work. I don't get everything from my husband. I don't get everything from my friend. I don't get everything, it's combined. So, other coworkers, I'll be more open to talk to them about the specific patient, and we can talk by name because we collaborate on this patient. With my husband, I can just talk about like difficult patient and trying to find resources, trying not to slime all over people, but being mindful of the fact that you have different people in your lives for a reason. And use that.
Yeah.
If anyone who's listening to this and just like, I don't have different people for that. Well, then that means you probably need to find them because that can be overwhelming to expect everything from one person. It would be absurd for me to expect all of my fulfillment from my husband.
Mm-hmm.
There's no way he could possibly fulfill that. And part of that is me also being empowered to realize that I need to also, you want to receive validation from others, but I need to validate myself. So I sometimes feel like people struggle because they're like, I can't get all I need from you. And it's just like, well, you can't get all you need from one person or 3 people or even 10 people.
Right.
So you have to acknowledge that. And if you don't feel like you have other people to do that with, or even with yourself, then that's the sign of a greater problem. Like that's something that you need to acknowledge. And that's a really good therapy goal as well to work on.
Those are really excellent points because it's very true. You should never, expect that one person is going to meet all those needs for you and be all those things. I think that's why it's called a support network.
Yeah.
As opposed to, you know what I mean? Because it's multiple different sources that can provide you with different aspects of your support.
Yeah. It takes a village, not just to raise a child, but a person.
Absolutely.
Take a village.
Yeah. Very true. Very true. Thank you so much for your time and for, because I know that you have so many things to do. So I really appreciate, being able to sit down and talk to you. And this has been really awesome. I don't know if you've ever listened to any of the previous episodes of the podcast, but what I do at the very end is something called the finisher. It's basically just random questions that I ask that have nothing to do with mental health or self-care, but I love random questions. So, so let's see. For you, what was your favorite TV show in middle school?
It might have been, probably Buffy.
Okay.
Probably Buffy, but my favorite TV show of all time is Living Single.
Living Single. All right.
I can watch. Nice. There's not one day I couldn't watch. I love that show.
Okay.
Show in the world.
All right. And let's see, what are the top 3 destinations on your travel bucket list?
Oh, Hawaii.
Mm-hmm.
I don't know why this just popped in my head, but Azerbaijan just popped in my head. Maybe I just read something about it. No, that's not on my list. So I would say Hawaii. I don't know.
Hawaii, okay.
Your brain is even doing stuff you don't even know. And you're like, why did you do that?
Just starts putting things out. Yeah.
I want to go to Egypt. I want to go to Ghana. I want to go to Cameroon. So let's just say all that. Every single country in Africa.
Okay.
But specifically, I really want to go to Egypt and Ghana.
Okay.
I think that I'll say that's 3. I would love to go back to. I went to Istanbul, and it was amazing.
Wow.
So many different. I really like tea. So many different.
Oh yes,
so many different
I do
countries
too.
just do tea so much better. So yeah.
Yes. That's awesome.
Everyone has their own procedure for like doing tea and coffee, and like so many places it's just like spiritual, and like certain places call it a tea ceremony, but certain places don't. But if I could just like immerse myself in the way that different countries and continents do tea, I would love it. Because I just love tea. Like I think it's really crazy that I went to something like they charge you like $2 for tea. I walk around with tea and I will ask for hot water because I'm not paying $2.50 for a cup of Lipton.
Right. It's so ridiculous.
It's rude. And I'm just like, and then if you ask for more tea, they charge you another $2.50, or they'll just give you more water. And I'm like,
right.
I'm sorry.
Right.
Make it make sense.
What am I supposed to do with this used tea bag?
Yeah, but I wouldn't mind traveling the world just to immerse myself in everyone's tea ceremony, because tea is like it's a thing in so many different places.
Yeah.
But yeah, so that would be that.
Fantastic. That's awesome. Dr. Raquel Martin, thank you so much for being on the show and for just taking the time. You're absolutely welcome. And can you let us know how to get in touch with you? How can we, talk a little bit about your practice or what you're doing right now, and then if you have any projects coming up, and then tell everybody how to get in touch with you.
So
that's a lot. I know.
Residential treatment facility. So I do not have a private practice, but I do have a website, RaquelMartinPhD.com. It's not amazing right now, but we have a great landing page, a bio, and a way to contact me. I didn't go to school for design, so someone else. So RaquelMartinPhD.com. I have a podcast, Mind Your Mental podcast. They're quick, like the first season is longer episodes, but the second season we've made a transition and they're quick 15-minute episodes where I'm providing, psychoeducation and as well as tangible, actionable skills that you can use in your day-to-day and see if they work for you. I'm also on TikTok, Raquel Martin PhD, and Instagram, Raquel Martin PhD. No big projects coming up. I'm looking to all of the resources that I talk about on like coping skills. I'm looking to create just some fillable worksheets and like posters that are free to download on my website so that you can just kind of print out stuff.
Okay.
Because we pay for a lot of things that we shouldn't have to personally. So I was the biggest thing, but I also do speaking engagements on trauma-informed care, racial identity development. And if you wanted to book me for that, you can also fill out the request form on the website. But that's it.
Okay. All right. Thank you so much again for being here. Dr. Raquel Martin, take care.
Thank you.
Bye-bye.